I've started using Brymill Cryax 15 years ago, and I can't imagine daily practice without a Brymill Cryax literally at the tip of my fingers. Is there ever patient reluctance? Well, some patients, particularly kids, can be a little afraid of a Cryax. So I often demonstrate what the Cryax is going to do on my own hands or wrists. I also like the smaller Crybaby because it looks a little less intimidating for some kids. I talk to them about what to expect, and I'm not going to lie to a patient. So I do make sure my patients know what to expect, and I do pick them carefully. Tips for kids and sensitive adults. So cryosurgery can be painful. If they're very worried about it, I'll give them a topical numbing agent to use prior to the procedure. It's also one of the reasons I really like the Brymill Cryax. It has multiple different tips, so I can help control the flow. There's also a longer tip extension that I can use for difficult to reach areas, or for little kids with something like molluscum contagiosum. The longer tip creates a really fine spray of liquid nitrogen. Therefore, I'm treating less of the healthy skin, which therefore is less painful. It also makes the liquid nitrogen come out slower, so that can also hurt less. Patients often request cryosurgery. Patients that are needle phobic, just the thought of a needle to them is more scary and more painful than any other procedure. They'll often ask for cryotherapy. Also, patients with skin tags have often had many skin tags effectively frozen off. So I have patients all the time ask for liquid nitrogen cryotherapy or cryosurgery, especially if they've had it before, because it is so effective. There's many times that cryosurgery could actually be the preferred modality over excision or treating something with a scalpel. A classic example is if a patient keloids. Patients who keloid sometimes are treated with cryotherapy. So if you know you want to get rid of or remove a benign lesion on a patient with a history of keloiding, liquid nitrogen cryotherapy should be your go-to device. Cosmetic outcome is a huge factor in if I decide to use cryotherapy or not. Patients who have a history of keloiding, I'm definitely going to look to cryosurgery. Very fair patients like myself, cryosurgery is going to do great. Patients with a darker skin type, a Fitzpatrick 4 or 5, they're not good candidates for cryosurgery. So again, the end cosmetic result is always going to be a factor in deciding. Cryosurgery can make some great cosmetic outcomes. After 15 years of practicing in dermatology, I can't imagine a day without cryosurgery. Cryosurgery is quick, it's effective, it's got a great return on investment, and it's great for patient care.